I want to talk to you about the area of incontinence care for nursing home residents because it's a major area of neglect. Many residents who are treated for incontinence with briefs can lay 12 hours or more in soiled briefs. And it's not uncommon for some poorly managed nursing homes to see the staff even double brief a resident so that they can let them lay longer. The result of this is pain and suffering for the residents. Many of them will develop incontinence-related dermatitis. It's red, it's blistered, it causes epidermal erosion and infection and wounds. Not to mention the dignity and quality of life issues and the families who are horrified by this. So let's ask ourselves, why is this such a hard thing for nursing homes to manage? First, we have to look at the protocol for most nursing homes is to check every 2 hours. But there's no accountability for this. There's no way of knowing if it happens. So when we look at that protocol, what we find is the numbers don't work. I looked at an actual nursing home where we have the Biolink system. There's 100 residents in that nursing home. 70 of them are incontinent and wearing briefs. They have 15 nurse aides scheduled throughout a 24-hour period. And if you do the math on those at 70 residents, they would have to do 840 brief checks using the 2-hour protocol, which means each nurse aide would have to do a check 56 times in their 12-hour shift, or 4.6 times an hour. When we look at how Biolink functions, where we're using alert-based technology to send the residents in the room, same 70 residents, 4.5 times a day we're alerting for incontinence episodes. So we reduced that 56 times a day they're supposedly checking on the resident to 21 times a day, or approximately 1 check every 1.75 hours. The math works. The residents get care, and it's a much better way of doing things. The average response time we see to a Biolink episode of incontinence is about 1 hour. And we have accountability. We know which certified nursing assistant went in the room, how long it took them to get there, and then we provide them with incentives to move faster and get to that resident and provide them the care they need quickly. That's why the incontinence care for a Biolink resident is better. We have less skin breakdown, we have less UTIs, we have less pain, we have less suffering of the resident. It works extremely well.